Hi, my name is Brett Taylor. I'm a dentist and author of the Getting You Right series of books. Obviously that's not my photo you're looking at now, that's Elizabeth. More about her in a moment. When I say series, I've actually only finished one of the books, but I have every intention of moving the rest through the pipeline, so hopefully in the future you'll see a few more of the books that are on the website. This video is intended as a guide to how to use the first book, the Getting Your Smile Right book. And I'm just going to give you a few tips on how to introduce that to patients. My theory is that there are more dentists scared of patients than patients scared of dentists. And the thing that scares most dentists is rejection. We don't like being seen to be salesmen, and as a result of that we don't offer our patients the best that we have to offer. And I think that's extremely sad for us and extremely sad for the patient, because there are so many good things we can do out there, and a lot of the stuff we take for granted as being rather simple or mundane is the sort of thing that can really significantly change someone's life. And Elizabeth here is a good example of that. That's why I'm using her. She's in the book. A lovely young lady who came to me with that dark front tooth. Now, we as dentists know that a dark front tooth is fairly easily fixed, and I suppose we see it all the time, but how often do we dig deeper and offer the services that we can perform quite easily to people like her? And it's easy to forget the impact of something like that on someone, and particularly on a young girl. I mean, I've got daughters now, and to think that my little girl would go through life being self-conscious about something is it's quite heart-rending as a father. So Elizabeth here came to me, and she had that dark front tooth, and this is a teenage girl going through all the angst that teenage girls go through, wanting to fit in, and she's not fitting in because she doesn't look normal. What do we do for her? Well, pretty simple stuff. We just whiten the teeth and put a single crown on. Now, that's not really outside the realms of pretty much any dentist to be able to do that sort of stuff. I mean, all it really requires is a good lab and a little bit of skill. Whitening's not rocket science. What is rocket science is deciding to introduce this stuff to people in a way that's not going to make you feel rejected, not going to make you feel like a salesman. And I think dentists need to get over the fact that people want the sort of things we can do. I mean, what this is like, a couple of $1,000 worth of work, some whitening and a crown. But what sort of difference has that made to this girl's life? And people like her every day in your practice, my practice, are not getting this sort of treatment because we don't offer it to them. And we don't offer it to them because we're scared of being seen as salesmen or scared of being rejected. So the book's there to help you introduce these concepts to patients. It's written in a way that explains aesthetic dentistry, explains the benefits of aesthetic dentistry. It's not you trying to sell something. It's a communication tool to hand to the patient to allow them to decide whether they want the sort of treatment that we can do. And the truth is, a lot of them do want it. So the beauty of the book and the way it was written is that it's a patient advocacy book. The patients are expected to read it. There are celebrities in it to make it a little more interesting. And my experience in my practice is the patients have looked at the book, seen themselves in it, seen the benefits they can achieve, and they've asked me for solutions. And so I don't feel like a salesman anymore, trying to push, trying to peddle my wares. I'm much more a guy who's just going through the options that patients have And for me, that's a much less stressful way to live my life, to practice my craft, and to be able to deliver, the sort of work that we delivered to Elizabeth here. I hope you buy a few of the books, hand them out. I'd recommend that you send them to new patients as a start, so that when they arrive you can have a conversation about what's possible. Most people can have teeth that look a little better, be it with whitening or just repairing a few chips or doing things that are a little more extensive. But most of the people we see have the ability to look a little better, and most of them would feel a lot better about themselves if they did look a little better. It's not your decision as a dentist what a patient wants. It's the patient's decision. And my experience with the book so far, and with the people who have been early adopters, is that the conversation that dentists have with patients with the aid of this book is a whole lot more comfortable than trying to deliver treatment that makes you feel like a salesman. So I'm happy to be a salesman though. So buy the book, click on the order button, and make your practicing life a little bit easier.